pregnancy test. When to take, types and accuracy. How does a pregnancy test work? What is a pregnancy test? A pregnancy test is a way to determine if you're pregnant. If your pregnancy test is positive, it means you're pregnant. If the test is negative, it means you aren't pregnant. Pregnancy tests work by detecting human chorionic gonadotropin, HCG, a hormone your body makes when you're pregnant. If you're pregnant, your body starts to produce more HCG. Your HCG levels start to build up once the fertilized egg implants in your uterus, about 6 to 10 days after conception. There are two main types of pregnancy tests: urine tests and blood tests. Often, you'll take a urine test at home with a home pregnancy test. Blood tests to check for pregnancy happen in your healthcare provider's office and involve giving a sample of your blood. The other way to confirm a pregnancy is by using an ultrasound. What hormone levels are checked for a pregnancy test? Pregnancy tests look for an elevated amount of HCG. Levels of HCG rise quickly, doubling every few days in the first weeks of pregnancy. The placenta produces HCG. Only pregnant people have a placenta, which develops shortly after a fertilized egg attaches to your uterine wall. When should I take a pregnancy test? In many cases, you might get a positive result from an at-home test as early as 10 days after conception. For a more accurate result, wait until after you've missed your period to take a test. If you get a negative test and then miss your period, take another test. In general, the best time is when you have your first morning pee. When possible, try to wait until it's been 3 hours since your last pee before you take the test. You could also take 2 pregnancy tests to confirm you get the same result. How do pregnancy tests work? You can find HCG in your pee or blood. As the weeks go on, you'll have more and more HCG in your body, which will make it more likely that a pregnancy test will show as positive. In a urine test, a piece of reactive paper detects the HCG. Keep in mind that different brands of tests will take different amounts of time to show a result. If you take a blood test, your provider will take a sample of your blood and send it to a lab. The lab will determine the amount of HCG in your blood. What are the different types of pregnancy tests? There are 2 main types of pregnancy tests: urine and blood tests. At-home pregnancy test. They're easy to use and inexpensive. There are 3 ways to take an at-home pregnancy test. Pee in a clean cup. Then, place 1 to several drops of your pee on a chemical strip. Place the pregnancy test strip in your urine stream while you pee. Pee in a clean cup and then dip the test strip in the pee while it's still in the cup. A missed period typically happens around 14 days after conception. There are a few things to keep in mind when you take a home pregnancy test, including: use your first morning pee if you can. Don't drink excessive amounts of fluids before you take a pregnancy test. Check the expiration date on the package. Read the directions that come with the test thoroughly before starting the test, and follow every step exactly. Blood test. Blood tests are rarely done because they're expensive and tend to have the same result as a urine test. This is helpful for when your provider needs to know the exact amount of HCG in your blood, not just if there's HCG in your blood. A blood test for pregnancy might be done in special circumstances, such as for people who are having fertility treatments or when the healthcare provider thinks there might be a problem. These blood tests are slightly more sensitive than urine tests because they can detect very small levels of HCG. That means they can provide a more accurate answer very early on in pregnancy, within 7 to 10 days after conception. For this test, your blood sample is taken at your provider's office or the hospital, then sent to a lab for analysis. Results might take anywhere from a few hours to 2 days. Your HCG levels usually double about every 2 days during the first few weeks of pregnancy. Extremely high HCG levels might mean that you're carrying twins or that there's an issue with the pregnancy. Are all home pregnancy testing methods the same? The difference with your at-home tests will be the sensitivity of the test. For the most accurate reading, it's still recommended that you wait until you've missed your period. What are the advantages of using a home pregnancy test? Pregnancy tests are inexpensive. They're easy to use. Home tests provide results quickly. However, blood tests can detect pregnancy sooner and are the only tests to show specific amounts of HCG in your body. How long does it take to get results of a pregnancy test? Each home pregnancy test is different. Read the instruction manual carefully. Even a faint line on a pregnancy test could mean you're pregnant. A faint line is different than an evaporation line. An evaporation line may appear if you wait too long to check your results, meaning your pee is dry. Most tests ask you to read your results before 10 minutes. This ensures the pee doesn't dry up and you don't get an evaporation line. Can a positive test be wrong? A false positive is rare, but it can happen. This may be the case if you experience a chemical pregnancy or lose the pregnancy shortly after the fertilized egg attaches to your uterine wall. What type of pregnancy test confirms pregnancy first? A blood test confirms pregnancy first because it can detect a smaller amount of HCG as compared to a test that uses your pee. Are there any medications that can change the result of my pregnancy test? Antibiotics, pain relievers and alcohol don't impact your test results. However, fertility drugs are one exception. If you're taking fertility medications, reach out to your healthcare provider about your results to make sure they're accurate. What should I do after getting a positive pregnancy test? Pick a vitamin with folic acid included in the ingredient list. Call your healthcare provider for an appointment. Make sure to pursue healthy habits like not drinking alcohol or smoking during pregnancy. Will an ectopic pregnancy show up on a pregnancy test? Yes, you'll still have a positive result on a pregnancy test if you have an ectopic pregnancy. If you use pregnancy tests correctly, the results are 99% accurate. Contact your healthcare provider if you have questions about the results of your pregnancy test.